Tiffany, the dietitian and lactation counselor with the Hamilton County WIC program. Today I want to talk about different medications, alcohol, tobacco use, and any recreational drug use while breastfeeding. Unfortunately, many moms are told to pump and dump their breast milk if they start a medication. But most medications are actually safe during breastfeeding. When you start a new medication, we need to find out if that medication will cross over to the breast milk, and if it does, how will it impact the baby? We also want to make sure that it won't affect your milk supply. Some medications tend to decrease milk supply. So your WIC health professional has resources to look that information up for you, and we recommend taking those resources to your doctor, having an educated conversation with them, and then determining what's best for both you and the baby. Some over-the-counter medications, such as cold and allergy medicines, can interfere with milk production. The other type of medication I want to talk about is birth control. Sometimes certain birth controls can impact your milk supply. Estrogen-containing birth controls can lower your milk supply and is known to shorten the duration of breastfeeding between mom and baby. We recommend reaching out to your lactation counselor, and before you change anything, make sure you talk to your doctor. Recreational drug use can be dangerous with breastfeeding, and this includes marijuana use. What I would suggest is avoiding recreational drug use, including marijuana use, and contacting your doctor if you're currently using drugs recreationally. Moving on to alcohol. One of the most common questions we get is, do I need to pump and dump my milk if I drink alcohol? It's entirely dependent on how much you're drinking. When you drink alcohol, your body digests it, it enters your bloodstream, which then can enter into the breast milk, and baby can get that through breastfeeding. So baby can feel the effects of alcohol if you are intoxicated or if you feel tipsy. Now, you are going to metabolize alcohol differently after you have the baby compared to metabolizing alcohol before you got pregnant. So be very careful if you start drinking again. What we suggest doing is right after a breastfeeding session, try no more than 1 serving of alcohol and see how it affects you. Hopefully, if it does intoxicate you or makes you feel tipsy, you have enough time between that feeding session and the next feeding session for your body to metabolize it, for you not to feel intoxicated anymore. If you do feel intoxicated and it's time to feed the baby, we still want you to pump that milk just so you don't impact your milk supply and you're signaling more milk production. But instead of feeding that to the baby, we want you to dispose of it because it could have alcohol in it. All right, moving on to tobacco use. Tobacco use during breastfeeding can negatively impact a breastfeeding baby because it increases their risks for sudden infant death syndrome. Since breastfeeding decreases the risk for sudden infant death syndrome, we do recommend that smoking moms continue to breastfeed. But we have some tips for you. First of all, when you are going to breastfeed, kind of the same as alcohol, we want you to smoke right after that breastfeeding session. So then hopefully by the next breastfeeding session, you're metabolized that tobacco or that nicotine and baby isn't getting exposed to as much. Also, when you're smoking, please try to go outdoors in a well-ventilated area. It's helpful to have certain clothes that you wear when you smoke, or even just a jacket to put over your regular clothes. Then when you come in from outside, go ahead and wash your hands thoroughly and make sure you're washing your hands before you touch anything that maybe would end up in the baby's mouth, like bottle nipples or pacifiers. Washing your hands thoroughly before touching anything and then also wearing different clothes will limit the amount of exposure that baby has to the tobacco product. We strongly encourage moms to stop smoking if they can, and to contact their doctor about non-nicotine resources to help them quit. Also, if you live in Ohio, there's a resource, it's 1-800-QUIT-NOW, and they can give additional support for quitting smoking. With everything we've talked about today, I do want to point out, before you make any changes in your routine, please talk to your doctor first. And if you have a lactation counselor, talk to them too to make sure that you're going to have success with breastfeeding if you start a medication. There's lots of different factors to to think about when you're starting medications, or if you want to drink alcohol or use tobacco products. So definitely talk to a professional before you change anything in your normal routine.